afternoon. I'm Corina Ramirez. I'm a family nurse practitioner that's working with Dr. DeWitt. I am very excited to be here and very excited for this presentation. How many of you guys have been into a presentation before for diabetes? A lot of information usually. So I'm hoping to get a lot of the stuff. If you guys have any questions, there's a lot of information. The girls are going to get the slides to take them home. That way you guys can review if you have questions or if you want to review them at home. But there's so much to cover and so much I'd like to tell you guys about it. But unfortunately, I have 20 minutes and I have to talk fast. So one of the things that we're going to talk about with diabetes, or we're going to talk about several things, but we'll talk about what is diabetes, some statistics, how you can get diabetes, the different types, what are symptoms, how do you get tested, how can you control or prevent, how it can affect your body, and is it curable? And then we'll talk about places where you can get education or further education for yourself as well. So what is diabetes? Diabetes is a chronic disease. According to the CDC, it's a chronic disease that affects your body in the way that it turns food into energy. And so what happens is when you eat, your body will turn that food into sugar, and it is released into your bloodstream. And then when that happens, your body will signal the pancreas to release insulin. In a normal, healthy, non-diabetic person, your body will release the insulin to get rid of the glucose in your body when you're eating. In diabetes, you either are not able to produce insulin sufficiently, or you're not using the insulin that your body is producing efficiently. And this kind of gives you a picture. I'm big with graphics, but it tells you kind of what we're talking about. This is your pancreas. So your body, when you eat food, it releases this insulin into your body. This is your vessels. And that insulin will get into the insulin receptor and allow the glucose to bind to the insulin so that your blood sugar levels stay within their normal limits. In a type 1 diabetic, this happens where there's not enough insulin or little to no production of insulin by the pancreas, so there's no insulin receptor that can bind to the glucose. In type 2, you have that production of insulin, but your receptors aren't using it efficiently. That means you're not binding, you're having insulin resistance. I'm not sure if you guys have ever heard of that. To the insulin receptors themselves, and so you can't bind to the glucose production. Any questions so far? No? So what are some statistics? 30.3 million people are said to have diabetes, with 90% of them to have type 2, and 5 to 10% to have type 1. Some of you guys have probably heard of pre-diabetes, which is kind of like a fair warning, or like a before you go into diabetes. 84.1 million have said to have pre-diabetes. They're over the age of 18. And then there's also what's called gestational diabetes, that is diabetes that happens during pregnancy, that is about 9.2 prevalence. Facts are that it has tripled in the last 20 years. It is the leading cause of kidney failure, lower limb amputations, and blindness in the United States, and it's the 7th leading cause of death in the United States. So some of the risk factors will be overweight, sedentary life, which is no exercise, history of gestational diabetes, so if you had diabetes when you were pregnant and hadn't had diabetes before, if you're African American, Hispanic, American Indian, or Alaskan, family history of your brother, sister, parents to have type 2 diabetes, PCOS, which is a polycystic ovarian syndrome, and smoking. And I want to emphasize these are risk factors. This is not a guarantee that you have it or will get it, but these are kind of things that put you at risk for developing diabetes. So these are the different types of diabetes that are given to us as far as pre-diabetes. That is hemoglobin A1C of 6.5 and below. Type 1 is usually what you would call when you have no insulin production. Type 2 and gestational diabetes. Pre-diabetes, we talked about it when your blood sugars are higher than your normal, but they don't classify you quite yet as a type 1 or type 2 diabetic. Your pancreas is producing the insulin, but you're still not able to use that insulin. You have some insulin resistance. It does put you at an increased risk for type 2 diabetes, heart disease, and stroke. And one of the things about pre-diabetes is with diet, exercise, healthy meals, preventing smoking, we can bring that down and make that better. Type 1 diabetes is our juvenile diabetes, or what's named as juvenile diabetes. This is whenever they believe that this is more of an autoimmune disorder that attacks your body, attacks the production of the pancreas, attacks the pancreas to produce the insulin. And so your body doesn't produce insulin that it needs to be able to get rid of the glucose. Pancreas, or usually this is seen as a child or teen, but can develop at any age. So you can be an adult and develop type 1 diabetes. Type 2 diabetes is what is considered an adult onset. It can affect, now we're seeing an upraise in obese teens that are developing type 2 diabetes, and usually it is seen because of family members having a type 2, that they're seeing it at a younger age now where they are developing the type 2 diabetes. This is where the pancreas makes the insulin, but it's not enough or cannot use it as well. Common in, like I said, families. Gestational diabetes is thought to believe that whenever you are pregnant, your body will block the action of the insulin. So you're still having the production of the insulin. It's kind of like the type 2 diabetes, but the hormones that you're producing with the pregnancy is causing it to be resistant. So this makes your blood sugars be high during pregnancy. This happens usually towards the 24 to 28 weeks is usually whenever we check for this. And it happens later on in the pregnancy after the baby has already been formed, but it is while the baby is growing. So this is where we see if we have a patient that has not had good prenatal care, we'll come in with a large for gestational age baby, which means the baby is very big and has extra fat from it having all the extra sugar from the mother. So signs and symptoms. Frequent urination, extreme thirst and hunger, increased vaginal and skin infections, slowing healing infections, unable to get a wound that's getting better for a long period of time, and sudden unintentional weight loss, blurry vision, the fatigue or numbness and tingling of your hands and your feet are some of the symptoms that you can have with diabetes. With testing, what we usually do is we do a fasting blood sugar, and that tells us the best as far as where your blood sugars are at that time. Fasting is no eating or drinking for at least 8 hours. We do that as one of our markers. The other marker that we use is called the hemoglobin A1C, and that is an average of your blood sugars over a 3-month period, and it tells us where you're at an average after you spike your sugars, even after you eat. Even before when you're fasting, it gives us a better predicament of where you're at. For the oral glucose tolerance testing, they can do them on somebody that's not pregnant to see how you do as a reaction to what they do is they give you a drink and then they monitor 1 hour, 2 hours to see if your body is, their blood sugar is too high. This is mostly used in patients that are pregnant. One of the other things that we check, of course, is your lipid profile, which is your cholesterol, and then we check your kidney markers to make sure that there is no changes in your kidneys or damage to your kidneys because of the diabetes. Managing diabetes. There's a lot of things that we do once you have been diagnosed with diabetes, one of the things that we start off with is your diet and exercise. And by diet, I don't really mean a diabetic diet, and Tamren will be able to talk to you guys even further about things that you can do, but it's more of a meal planning, portions, watching what you eat, and making sure that you're portioning the things that you need for you to be able to keep your blood sugars at a maintained area. Exercise is very important. Cessation of smoking, avoiding alcohol because of the sugars in the alcohol. Regular home monitoring is one of the big things that I'm big with that, because the best way for us to be able to take care of you will be by knowing where your blood sugars are at home. We can do the blood testing, fasting, and we can do the hemoglobin A1C, but the best way of knowing exactly how you're reacting to your daily living is going to be by home monitoring of your blood sugars. Medications, there's several medications now out there. We still have metformin as the number one to start off with somebody that is diagnosed with diabetes, and that usually helps with the insulin resistance. If that's not controlled, then we go into some of these newer medications that help now, that there's a lot of research behind, that help with heart disease and better reaction as far as the blood sugar is controlled. Regular diabetic visits, making sure that you're keeping those every 3 to 6 months, however your doctor provides as far as following up, because with those annual exams or those 3-month exams, we are checking everything from your microalbumin, which is checking your kidneys, making sure there's no changes. We check your hemoglobin A1C, make sure that that is controlled. We check your feet to make sure there's no changes as far as the sensation, the neuropathy, anything like that. Routine eye exams is one of the things that we remind you whenever we talk about that, because the diabetes can affect your retina, and so we want to make sure that you are getting those routine eye exams and diabetes has not affected that. Vaccination management, it doesn't. One of the things I was reading as far as the myths, and there's a lot of beliefs that people tend to feel that they get more sick or they have a higher chance of getting sick because you have diabetes. It's not so much that you have a higher risk of getting sick, you just have a higher risk of not getting better from this disease. And so this is why we recommend you doing the tetanus, the pneumonia vaccines, influenzas, and Hep B's, and making sure your immunizations are up to date, because if you do get an infection, it'll be harder for you to fight it because of the diabetes. Complications. One of the big things that you'll see is hypoglycemia. Most of these new drugs have been very good about controlling where your blood sugars get very low. They don't react as much as to keeping your blood sugars very low like you do with back in the day. They would do more insulin. Insulin, you don't, it's one of the things that with type 2 diabetes we don't usually start off with. It's more of the last resort as far as getting you managed, unless you have type 1. But some of the symptoms: sweating, trembling, dizziness, hunger, confusion, seizures, and loss of consciousness. Things to keep in mind as far as making sure you have glucose tablets or emergency gel glucose that you will have there in case you were to have any of these symptoms and you're not home or you're not able to get to somebody in time. Diabetic ketoacidosis is when your blood sugars get very high to the point where you're spilling ketones in your urine, have nausea, vomiting, abdominal cramping. Usually blood sugars are anywhere from 500 to 1,000. Retinopathy, which is the changes in the retina. We talked about the diabetes being one of the leading causes of blindness, and that's from the retinal changes. Neuropathy is causing of nerves that causes numbness, tingling in the legs and arms. So if you're having any changes as far as the sensation in your arms and the tingling, that can be from the diabetes affecting the nerves in your body. Nephropathy, which is kidney disease, is one of the things that is a complication from diabetes if diabetes is not well controlled. It can lead to kidney failure and the need for dialysis to be able to get rid of those products. Atherosclerosis is your hardening of your arteries. It is one of the things that causes you to be able to have strokes, heart attacks, puts you at risk for heart failure. This is all, these are all changes that can happen with diabetes. Peripheral artery disease is the decrease in circulation into your feet. This is what makes it harder for you to be able to, if you have developed diabetic sores into your feet, this is what makes those sores harder to get better, because you don't have the circulation that you need into your arterial system in your feet to be able to produce the oxygen that it needs and the blood that it needs to make those better. It is one of the leading causes of amputation due to death of the body tissue. Digestive system, one of the things about digestive system is once your diabetes starts beginning to affect your nerves, it can cause what's called gastroparesis, or delaying in the emptying of your stomach. It can cause filling of the fullness of the stomach faster, nausea, vomiting, pain, abdominal bloating, can cause your blood sugars to go up and down quite a bit. This is also something that can happen as a complication. Oral health, gingivitis, periodontitis. Men's health, I gave you one of these samples as the men's and diabetes, and then the women's and diabetes. I found it off of the Johns Hopkins website, and I found it very useful because it goes into details as far as what changes it can make between men and women and how it affects you differently. And in mental health, can cause depression, denial, anger, and stress. Unfortunately, at this time, there is no cure for diabetes, but we can help you prevent it and control it. And by preventing it, we start with pre-diabetes, being able to control your blood sugars, diet, exercise, bringing that hemoglobin A1C down, and then once we are diagnosed with diabetes, then we're able to, by keeping these routine appointments, we can help you control it the best way that we can, including having dietitian come in and talk to you guys about any questions, concerns, and the more you work with your provider to tell them how you feel, what you're feeling as far as your symptoms, any complications that you might have, the better they'll be able to help you in keeping this controlled. These are 3 of my favorite places to get education as far as this disease. It's the American Diabetes Association, National Diabetes Information Clearance House, and the Center of Disease Control. Those are the best places that you will find information that is factual, that will lead you in the right direction as far as anything needing from diet, from support systems, from you name it, blood sugar logs. Great resources for you to go to. Those resources I used. Anybody have any questions? No questions? Thank you for allowing me to do this.
My name is Tamren, Terhune. I'm the dietitian here at Ochiltree General Hospital. Like Corina was saying, nutrition is a really big factor in managing your diabetes. Usually the first time you get diagnosed with diabetes, hopefully you have a low enough A1C where they just put you on metformin and then you get a dietitian consult. Because really those are the 2 biggest things. Your medication, your diet, and your exercise can really keep you at a low. It's a lot easier to keep you low than to try to get you from high to low. So this is really where we start, and this is just where we continue. So I want to share with you a couple of diabetes and food myths that I hear a lot. I've been in diabetes education for the last 4 years. The majority of the patients I see, probably about 90% of them, are for diabetes. So I hear a lot, and there's a lot of misinformation out there, kind of like Corina was saying, with some of those resources that she had. There's a few really good resources and then a lot of really bad resources. Facebook is not going to be your best friend when it comes to finding reliable information. And I hate to tell you, even your grandma's not going to be a really great source when it comes to good information about managing your diabetes, because just like this disease changes over time, research and information and treatments change over time too, and so we try to adapt to that and keep as abreast as we can on that information. But some of these that I hear a lot is when patients come in and say, okay, well, I'm going to get put on a diabetic diet now. What we found is with diabetic diets, there's really no such thing as a diabetic diet. It's really just about changing, just taking what you're doing right now, your lifestyle. Diabetes is so individualized. Diabetes is different in every single person in this room. So why should your diet be the same as every person in this room? You all don't like the same things, and there's things that you do like. You all have different lifestyles, families, jobs, times that you wake up and go to sleep. And so we try to manage that and change just a little bit, just modify what you're doing to help help you have a healthier life and control your diabetes a little better. I hear this all the time. Well, now that I've been diagnosed with diabetes, I can't eat anything white. And let me tell you, there's a lot of great white foods out there, including cauliflower, jicama, potatoes. Oh my gosh, she said potatoes. Yes, potatoes can be included in a healthy diet. And when I say diet, this is just a healthy lifestyle, just a healthy eating lifestyle. The thing I don't like about diets is diets are kind of like trains. You get on a train and you get off a train. You don't just stay on the train the rest of your life. It's like a diet. You don't just stay on a diet typically the rest of your life. It's all about lifestyle. So it's forming that mindset that, okay, I'm not on a new diet because I have diabetes. I have to change my lifestyle so that I can prolong and live a happy, healthy life for myself and my family. We get a lot of people that say this, particularly men. I don't know why they're a little bit more stubborn than women, but I can basically eat whatever I want because I'm on medication that controls my diabetes. That's going to be false because, like I said earlier, diabetes changes. If you're on metformin and eating the same thing, you haven't really changed anything, but you got on metformin, that's going to work for a little bit, but then it's not going to work anymore. Your body's going to overtake that metformin. Your blood sugar is going to start getting higher eventually. I haven't seen any patients where they just stay on one. So they jump to the next medicine. If they haven't changed anything about their diet or exercise, they're going to eventually, it's going to get better and then it's going to get worse. And then you get put on insulin. So if you don't make those changes with your diet and exercise, your disease is going to keep progressing, which can lead to those complications that Corina talked about. Eating sugar will not give you diabetes. Now, if you have a family history of diabetes, you eat a whole lot of sugar, which is making you gain weight, that extra fat around your midsection in particular, and just that extra fat that you're carrying around can cause insulin resistance. So, in a roundabout way, maybe some people can say that, but if you're just eating cookies, if you eat a cookie every day, it's not going to give you diabetes. You have to have several other risk factors going along with that. And then you only have to watch your carbs. I hear that. So so just tell me what to do about my carbs. All I know is I have to control my carbs. It's not just about carbs anymore. You have to just be considerate of everything else that you're eating as well. So what makes up food? There's 3 different types of macronutrients. There's carbohydrate, protein, and fat that makes up what our bodies need to survive. Carbohydrates are what provide energy for our bodies, not just energy that, okay, I can get up in the morning and, I've got all this energy. It makes your liver run correctly. It makes your lungs breathe correctly. It makes your kidneys work correctly. That's the energy. Your entire body, every single cell in your body requires carbohydrates for energy. Protein are what make, it's basically the building block of your body. It's what repairs tissue when things get damaged. It's what, when you're younger, you need more protein because you gotta grow. You're constantly rebuilding tissue. And fat is what helps with all kinds of, it helps with all kinds of body process. It helps with hormones, reproductive systems, it helps lubricate your joints. So you need, all of these do provide some energy, but they're not the preferred source of energy like carbohydrates are. So I want you to kind of understand just what we're looking at with digestion here. So you eat this and it goes in your mouth. What happens when you start chewing and start breaking up that food, there's these hormones, and Corina kind of talked about it already, that signal your pancreas to release insulin. And again, insulin is what, whenever that hamburger, whatever food you're eating, comes down in your stomach, gets broken up into tiny little bitty particles. It turns into glucose. All that carbohydrate turns into glucose and comes right here where it's absorbed in your small intestines. This is where this magic happens over here, okay? It starts getting broken down in these tiny, tiny little cells. The pancreas releases insulin. Insulin comes in, basically acts like a key to your car door, opens up your cell. No matter what kind of cell it is, muscle cell, heart cell, lung cell, brain cell, glucose comes in and now it can work properly. So you'll notice if you've ever tried to cut out carbohydrates in your diet, this is how you feel. No energy, or maybe right before you were diagnosed and you didn't have that glucose coming in. You didn't have any energy, you just felt down and groggy. On the other hand, when it's working right, you feel great, you feel good, you've got some energy. Your body's doing what it needs to do. So just a little background on that. So carbohydrates are the nutrient that raises your blood sugar. So when we talk about sugar, again, it gets broken down into glucose. Glucose gets absorbed into your bloodstream, and that's what that blood sugar is. That's what we measure when you measure glucose and fasting and A1Cs. But these are the main types of foods that will raise your blood sugar. These are the carbohydrates. Your grains, pasta, rice, bread, all of those, any type of fruit juice. Starches, these are your potatoes, beans, peas, legumes. Milk and yogurt, this is one that people don't really think about very often. And when I'm talking about milk, this is mostly just milk, like cow's milk and soy milk. Now the other types of milks that are out there, almond milk, cashew milk, coconut milk, those do not raise your blood sugar like these do. It's a different kind of carbohydrate. And then sweets, these are the obvious ones. Anything that contains sugar, honey, fructose, those will all raise your blood sugar as well. So what I really want to emphasize about carbohydrates is you do not want to eliminate them completely from your diet because, like I said, they're your body's main preferred source of energy. If you don't have carbohydrates, your body's not going to function the way it needs to, and you're going to feel groggy, you're going to feel bad, and your body just literally cannot function off of just protein and fat and vegetables. It needs these carbohydrates to survive. So what we do is, how do we balance that? Okay, so I can't have too many carbohydrates or else my blood sugar will go out the roof, but I haven't got to have enough carbohydrate so that my body will function normally, properly. So for most people, we offer moderate intake depending on your size, depending on your activity level, depending on if you're pregnant or breastfeeding, you'll get a little higher, up to 4 to 5 servings per meal of carbohydrate. And if you're looking at the back of a food label, which your chips have a food label, which I wouldn't recommend getting out right now because it's loud, but if you have it turned over and you can look on the back, you'll see where it has the servings of carbohydrates, and 15 grams of carbohydrate is 1 serving. As far as fruit goes, it's about the size of your fist, 1 cup. As far as your grains, legumes, pastas, beans, peas, all that, it's about half a cup is 1 serving. So we're looking right here at about 2 to 4 servings per meal. Okay, now if you're someone that eats 2 meals a day, we gotta get you on 3. So it needs to be at least 3 meals a day. But you'll look at this, and even this healthy plate, this has kind of been the go-to for the last several years, and I really like it because it's simplified. You know, does anybody remember the food pyramids and all that stuff? So confusing. This actually gives you a visual representation. So here's the carbohydrate right here with grains, just kind of how you're supposed to split up your plate. So 1/4 of it protein, 1/4 of it's going to be your starch or grain. Sometimes they have both of these as non-starchy vegetables, a fruit here and dairy here. Sometimes they keep it here. It just depends. This was the first version of it out there, and I like it because it gives you 1 carbohydrate here, 1 serving of carbohydrate here, and then 1 serving of carbohydrate there. So that fits right in between of this, what we call moderate intake of carbohydrate. Does anybody have any questions about this slide? Okay. Again, like Corina said, there's a lot of information to cover in a very short amount of time, and anybody that's ever sat in an office with me knows that these usually take about an hour just for the nutrition side of it, and you're just barely skimming the surface on it. So how do we eat carbohydrates? So when you have diabetes, you need to eat your carbohydrates just a little bit differently, maybe compared to somebody that doesn't. But even if the person doesn't have diabetes, this is still great. This is still great information and great advice to do for yourself, because it will keep your blood sugars under control. Whether you have diabetes or not, you can still experience spikes in your blood sugar, and we want to prevent that. So by pairing your carbohydrates, so again, those grains, fruits, starches, milk and yogurt, by pairing those together with a protein, a healthy protein or a healthy fat, you can actually prevent those spikes in your blood sugar, where they go really, really high. Has anybody ever experienced just a spike? Some of you may feel it, some of you may not. It just depends. But what it does, protein stays in your stomach a little longer. So when you eat something, and let's say, we'll just take this for example, these apples and cheese. Little snack there. So that will stay in your stomach longer than if you just ate this apple by itself. And what that means, as far as your blood sugar goes, is that you're slowly trickling glucose, you're slowly trickling sugar into your bloodstream versus hitting it all at once with just straight carbohydrate. So it kind of acts like a weight. I think of protein as kind of like a weight. It's kind of holding that carbohydrate down, it's kind of holding that blood sugar down a little bit compared to if you didn't have any protein at all. Protein or a healthy fat. Okay, and the next thing that's going to help keep your blood sugar down while you eat carbohydrates is by focusing on fiber. So we hear fiber a lot, and fiber is going to be one of my favorite nutrients, has been for years, for a lot of reasons. One, it's a low fiber diet is your biggest risk factor for colon cancer and all sorts of colon problems. So low fiber diets and sedentary lifestyle, obesity, all that increases your risk of colon cancer. Low fiber diets also increase your risk for heart disease and obviously diabetes. So by including fiber in your diet, switching from white bread, so this is kind of like the little modifications that we're talking about. If you're eating a sandwich, which today we had whole grain bread, you normally eat your sandwich on white bread. By switching to 100% whole grain bread, you're doing a significant justice to your diabetes and helping manage that. So by just making little changes like that, by switching from brown rice to by switching from white rice to brown rice, you're making a huge difference. So apple juice is one of those things, and juice, not just apple juice, but just juice in particular. It's one of those things we really don't recommend for anybody with diabetes. It kind of acts like a regular soda. So here in the hospital, when we have somebody in here with diabetes, they're getting juice if their blood sugar drops, because that's the point of juice in the hospital, is to raise your blood sugar up quick, okay? If your blood sugar is not low, it's still gonna raise it up quick if you just sit there and drink a glass of juice. So instead, we offer up a whole piece of fruit. So instead of drinking juice, you want to eat a whole piece of fruit because it has fiber. Fiber is a carbohydrate, but it doesn't get absorbed, which is great, which is why it's great for colons and why it's great for your intestines, because it just kind of goes through and cleans everything out. It doesn't get absorbed, it just stays in there and cleans everything out. So, you've got an apple, small apple, and half a cup of juice. Those have the same amount of carbohydrates, but you're not absorbing near as much of that that sugar from the apple as you are from the juice. Same thing with all of these other foods that don't necessarily have fiber in them. Why? So whenever you take bread or rice or pasta and you mill it down, if you don't leave that fiber intact, which is where you get whole grain pasta, brown rice, if you don't leave that fiber intact, then that's where you get the white bread, white rice, those sort of things. So really focusing on fiber altogether can help keep your blood sugar lower just by making those little bitty switches throughout whatever you're eating. If you like spaghetti, awesome. I love spaghetti, but I eat whole grain spaghetti, and it makes a huge difference in your blood sugar. By choosing more nutrient-dense options, especially whenever you're eating snacks, doing strawberries, something sweet. If you're a sweets person, you're craving sweets. Strawberries are going to be better than cookies. Whole grain crackers are going to be better than potato chips, and I didn't even think about whether I was doing this in our lunch today with cookies and chips. But at least your chips today, some of you probably got some of those baked chips, which are pretty good. And then choosing more nutrient-dense options like non-fat milk, reduced fat milk versus a soda. So a lot of these are just empty calories that are going to increase weight, which we don't want because weight gain can increase your risk of getting diabetes, or it could worsen diabetes with weight gain. So we want to make sure we're sticking to the lower calorie, higher nutrient options as far as your carbohydrates go. Because there's all kinds of carbohydrates out there, but there's a healthy way to do the carbohydrates. And then kind of going from that soda to the drinks, this is where I find people can make a significant difference in their diabetes control, is by switching what they drink. Simply switching what you drink. Doesn't mean you drink any more, doesn't mean you drink any less. But by switching from regular sodas, juice, lemonades, energy drinks, Gatorades, all of those, by switching to water, unsweet tea, even like that seltzer water, if you have that carbonation that you crave, by switching to that, I have seen people make significant drops in their blood sugar and A1C, which is the goal, and obviously a healthy lifestyle. Great for your kidneys. When you make those switches, great for your heart, just great for everything. Your body's mostly made up of water, so why not give it what it needs? So again, one of those just small little modifications that you can do to make a big difference. So this is just kind of a chart that I like to show you a visual of what your blood sugar can do when you eat certain foods. So let's just take, for example, I do this a lot with my clients and I just draw it out. This is a lot prettier than my drawings, I promise. But here's our fasting. Let's say we just woke up at 6 o'clock in the morning and our blood sugar's sitting here at 80, okay? And then we get hungry, we eat breakfast right here. Let's just say we ate a piece of white bread. Just one piece of white bread, 15 grams of carbohydrates, no big deal. Here's what it's gonna do. Now this isn't to scale or anything, and this is not scientifically proven that these numbers are gonna do this, because everybody's numbers are different. Everyone reacts differently to different things. Anyways, so this white bread, what it's gonna do is it's gonna shoot your blood sugar up. It's gonna spike it. It's gonna spike your blood sugar if all you have is a piece of toast, let's say. So you make a small choice. You make a small difference right here. You go with the whole wheat bread. So here's the whole wheat bread in the blue. Okay, so you eat here at breakfast, it's gonna go up. Your blood sugar is gonna go up if you eat carbohydrates regardless. But you see here, it's not gonna go up quite as much. And when it comes down, it's gonna be down a little lower 2 hours after you eat. That's postprandial, 2 hours postprandial is what that PP means. So it's gonna be down a little bit lower than what it would have been if you just ate white bread. Now let's do what we talked about earlier. We're gonna eat a really nutrient-dense whole wheat bread, plus add some peanut butter on it. We're gonna add some protein, a little bit of fat, some good healthy protein. Starts here, same thing, you eat it at breakfast, it's gonna go up a little bit, but really it's not gonna go up that high because it slowly gets digested, it has that fiber and it has that protein to help keep it down, and then you see 2 hours postprandial where it's gonna be. It's a lot lower than where it would have been otherwise if you would have just, had your normal breakfast of coffee and toast or a coffee and muffin. Now this is just this has no sugar, added sugar. Now let's say if it was a muffin or a donut. Then where would it go? We may not even be on this chart anymore. So just keeping that example in mind whenever you're thinking, okay, how do I do this best? Biggest thing I can tell you is not to skip meals. I am very, very, very passionate about this. This is one thing that I just pound into people, especially those that skip meals, is you're doing a lot more damage than you realize whenever you skip a meal. You're thinking, okay, well, I'm not gonna eat breakfast, then I won't have those carbs for the day and it'll be fine. I'm gonna reduce my calories, I'm gonna lose weight. It doesn't work like that. They say if you're ever wanting to try to lose weight, the best thing to do is eat at least 3 meals a day, sometimes even including 2 to 3 snacks in there as well. What that does is it keeps your blood sugar, so this is eating breakfast in the yellow right here. So you can kind of see, sorry for the shaky hand, but you can kind of see it doesn't just go crazy. It stays pretty well in this range. Your blood sugar is not going crazy. Now this is somebody who didn't eat breakfast. So it looks like, you know, in the morning their blood sugar was pretty low. This is somebody that's probably on a continuous glucose monitor. Has anybody ever heard of that? Continuous glucose monitor. It's a little thing that you wear on your skin and just read your blood sugar all day long. Mostly they have them in for about 10 days or so at a time. Or if you're insulin dependent and you have a pump, then that pump will read it for you, which is awesome. But this is somebody who didn't eat breakfast. It looks like their liver kicked in. Your liver will kick in. If your blood sugar gets too low, your liver will kick in and it will start making glucose on its own. So it's good to keep your blood sugar in a steady range right here so that your liver isn't kicking on and then you're eating on top of that. So now you have liver glucose and food glucose, which may be what happened right here. You've got your liver kicking on, trying to keep your blood sugar stable. Your liver will only do that for so long before it starts tiring out also. And then let's say right here you eat lunch, about lunchtime, 1 o'clock, and all of a sudden you see a spike. That's what you call a spike in your blood sugar, and that's where the damage happens. That's where we see lots of glucose flooding in to these very, very, very small vessels. Your kidneys are very, very tiny. The vessels that run through them, that's why kidney damage is so prevalent among diabetes, because sugar, that blood sugar, that glucose, can cause damage in those vessels if pushed through there in large amounts. Your kidneys filter everything, including the blood sugar. So that's why we really, stress about kidney health and making sure you're watching your kidneys. And that's why doctors are watching kidneys. That's why I'm talking about kidneys. These cause damage. These cause damage in your heart, in your eyes, those little extremities, your feet, your toes, your fingers, your ears, your nose. So this is where the damage occurs, and this is why we do not want to skip meals. So we want to make sure that we're eating a consistent amount of food, especially a consistent amount of carbohydrate, at least 3 times a day, and then maybe even adding in a snack or 2 with the protein throughout the day, just to keep your blood sugar stabilized throughout the day, so you don't have any of these, peaks and valleys. We don't want to see those. We like rolling hills. We don't want to go up to Colorado. We want to stay here in Perryton where it's nice and flat. But like I said earlier, and I'll just kind of hurry through this a little bit, we don't just worry about carbohydrates. We want to also be considerate of how much and what kind of protein and fat that we're eating, because diabetes also increases the risk of heart and renal disease. We've talked about that before. Heart disease is still the leading killer of men and women in the United States. And diabetes is a big reason behind that. Most people don't die of diabetes, they die of complications related to diabetes, heart and renal disease in most particular. High-fat diets not only increase your risk of heart disease, but it also increases insulin resistance. And once you have insulin resistance, that increases its risk of heart disease. So it's kind of a twofold thing. You kind of have a double jeopardy right there of increasing your heart risk. And then high protein diets, not many people realize this. Usually when they go on a diabetic diet or they go on a diet to lose weight or lower their blood sugar, they cut out carbohydrates and increase that protein. What that protein does is it can add extra stress on those kidneys, because again, your kidneys are filtering everything, they're tiny vessels, and that proteins are big molecules that have to go through there. And if you're putting lots of protein through your kidneys, you can cause a lot of damage. So recommendations from the American Heart Association, American Diabetes Association is to eat fish at least 2 times a week, at least 2 servings of fish. Limit your red meat and sodium intake. Replace some of your animal proteins with plant-based proteins like beans, nuts, legumes, and whole grains. Increase your polyunsaturated and monounsaturated fats. These are going to be your plant-based fats like oils, nuts, avocados, olives, seeds, and even fish. So that's why they also recommend fish. Those are great fats. Those are really healthy fats. Again, just like carbohydrates. There's really healthy fats and proteins, and there's less healthy fats and proteins. So I'm not telling you to eliminate any of these. That wouldn't work for most people, especially here in the Panhandle. It wouldn't work for me and my family. But we do try to limit some of these less healthier foods and try to increase some of the more healthier foods for us. And then try to reduce these saturated and trans fats that increase your risk of heart disease. Fried foods in particular, and any commercially prepared processed baked goods, pastries, things of that nature. And then some of the, poultry skin, butter, and animal fats. So this is what your proportions, daily proportions should look like as far as, how much fat, protein, and carbohydrate should I get. I told you your body really prefers carbohydrate. 50%, even if you're diabetic, 50% of your intake should be those carbohydrates, 30% healthy fats, and 20% proteins. It's not like your weight. This diet can help you lose weight, believe it or not. Most people think that this is supposed to be protein to lose weight. This is supposed to be carb, or maybe like 5%. And then, fat should be this other half. It doesn't, weight loss does not work long term like this. You may get it quick, but it's not going to be sustainable. To fill in the gaps, let's say, oh my gosh, I've ran through all my carbohydrates, I've had my moderate portion of meat, my fats, where else do I fill in? I'm still hungry. What am I missing out on? These non-starchy vegetables are your great go-tos. They're great for weight loss. They have little to no carbohydrates at all, so they won't affect your blood sugar. In fact, they'll improve your blood sugar because they have high amounts of fiber in them. High amounts of fiber, high amounts of water. They're extremely filling. And best of all is they reduce risks of every single chronic disease and cancer that we know of. So this is just in summary, kind of just going through what we talked about with modifying your carbohydrates and how to do that, not skipping meals, not forgetting about your protein and fat, that those are also important in your diets, and filling in the gaps with those healthy, nutrient-rich, non-starchy vegetables. Does anybody have any questions? Sorry, that was fast and furious. I know it is. I usually cover this stuff in over an hour. Does anybody have any questions or comments or any concerns? Okay. Well, if you would like any more information from me with diabetes is covered by insurance as far as nutrition counseling goes. So if you want more of an in-depth education, or sit down and go through your lifestyle and what you're eating and how to make changes for yourself, what you do is you just let your provider know. It would be Corina, Dr. DeWitt, whoever it is, and they'll get you a referral, and we can sit down and talk and plan out, work things around to help you meet your blood sugar goals. Same with anybody else if you have any family, because I'm going to assume anybody with diabetes in here in this room has family that probably has it also. So it's a great tool to have in your pocket. So we appreciate, Corina and I both appreciate all of you coming out to this luncheon learn. I'll be here for a little while if anybody has any questions. I'm sure you've probably got to get back.
I'll be here for a little bit too.
So anyways, thank you. We appreciate y'all.